Good morning and welcome to the latest installment of Treasure Coast Business Disaster Relief and Recovery, brought to you by the Virtual Business Recovery Center and the Corporate and Community Training Institute at Indian River State College. This webinar is sponsored by the Florida Small Business Development Center, hosted at Indian River State College, and the Economic Development Council of St. Lucie County. You may post questions and comments in either the chat room or Q&A area of this virtual meeting room, which you will find on your Zoom taskbar. Today's topic, Coronavirus and Charities, Insights on how COVID-19 is affecting the nonprofit community, led by CCTI Instructor, Tom Epsky. Thank you for joining us today, Tom.
Oh, thank you for having me, Katie.
And with that, I'll go ahead and turn the screen over to you.
Okay, well, thank you everyone for attending today's Virtual Business Recovery Center webinar. My name is Tom Epsky. I have the honor of serving the citizens of Florida as a member of the Florida Reemployment Assistance Appeals Commission. The commission is a quasi-judicial tribunal that acts as a court of appeal for contested reemployment assistance cases and generally involve issues surrounding workplace misconduct, employee relations, wage and hour violations, harassment, discrimination, and sometimes changes to the workplace that may be unilateral and material that would impel a worker to want to leave their employment. I also am an adjunct professor at Indian River State College, teaching classes in human resources, management, and legal issues. But I have to say my favorite role is as a volunteer. I was very fortunate to grow up in a family which instilled the values of service to one's community. And through the years, I have been a volunteer board member with Hospice, Big Brothers Big Sisters, and our local United Way. I currently serve as a member of the Board of Governors for the United Way of Florida. Today's webinar is going to focus on the coronavirus and its impact on the nonprofit community. Specifically, I will address some concerns arising from the COVID-19 pandemic that are directly affecting the nonprofit organizations. Now, each organization is unique and may have different concerns and impact. I definitely will have time at the end for questions. So please be sure to type in any questions you have in the comment or Q&A box at the bottom of the screen. So there is an acronym, VUCA. It was first used in 1987, and it was based on the leadership theories of Bennis and Nanus. And it stands for volatility, uncertainty, complexity, and ambiguity. It was actually a response to the US Army's War College during the collapse of the USSR. Suddenly, there was no longer the only enemy. And this resulted in the Army and the military having to think in new ways of seeing and reaction. Now, through the years, this concept has been adopted to the world of business in light of contemporary environments and the leadership required to navigate them successfully. VUCA is a catch-all for, hey, it's crazy out there. And for most of us, I would say the COVID-19 crisis clearly fits that bill. Thanks to the COVID-19, we've been bombarded by the mostly unwelcome outcomes of events unfolding in nonlinear ways. Now, a nonlinear system in math and science is one where the change in output is not proportional to the input. So in this kind of system, twice the time or double the production doesn't necessarily equate to twice as much output. Now, this can be truly mind-boggling for those grounded in rational linear thinking. But non-linearity occurs a lot more than most people appreciate and therefore accommodate every day. Complex systems, which truly describe our modern world, have nonlinearity as one of their characteristics. For the nonprofit organization, this takes on a completely new light. For example, many of us pondered some of the COVID-19 curves that had been broadcast. Curves like the projected rate of infection, hospitalizations, ventilator requirements, and death, all based on types of response taken to fight the virus. Like many others, you may have also wondered why those rates varied amongst jurisdictions. In the United States, for example, states and cities were compared. We read daily announcements and comparisons of differing outcomes for various counties. Lots and lots of curves. At once, many similarities and differences, another characteristic of complexity. So at its core, complexity occurs because numerous factors interact, frequently through interrelationships that are difficult to pinpoint and challenging to predict. We may understand part of a system based on its history, but we must be aware that past performance is no longer a reliable indicator of future performance. Let me say that again. Past performance is no longer a reliable indicator of future performance. Now, you may have heard or read that caution many times before, but not paid much attention to it. For a nonprofit in today's world, it is critical to apply that warning to most of your environment, made up of systems within systems, all of these complex and carry the same caution. Now, since we've looked briefly at complexity, let's just take a quick look at the other terms. So volatility, especially in the COVID-19 world. Volatility is about change in the system, both rate of change and impact of particular change. In the pandemic, we have both high rates of change and quite variable outcomes from prospective initiatives. Journalists talk about the pity for authors of economic textbooks because every day COVID-19 during this crisis, it's become necessary to literally rip out a new page and start again. So we should get used to new courses of action being taken based on the emergent data of just yesterday. Last week's is well past its use by date. Uncertainty, especially in the COVID-19 context. Uncertainty talks about predictability. Predictability is low. I mean, who would have imagined toilet paper becoming a proxy for uncertainty and fear? In some places, there's a huge increase in the sale of firearms and ammunition. We haven't even mentioned the medical uncertainties connected with the pandemic, such as still today, who's going to get it? How will it impact individuals? Will vaccines work? How long will they take? Surprises are a matter of course, and thankfully, some of these will be positive. And then finally, ambiguity. Ambiguity abounds. Recently, you may have heard or even had some of the following thoughts. I have cold or flu-like symptoms. Do I have the virus? Can I get tested? Remember when the cruise ships were off the coast of Fort Lauderdale a few months ago, and we thought, wow, with crews and passengers not having a port to call home, will those sick people claim scarce ICU beds and ventilators here in Florida, ahead of our population if it came to that? All of these and many others illustrate the ambiguous challenges of this COVID-19 context. Now, luckily, most business climates, including the one created by the coronavirus, are not volatile, uncertain, complex, and ambiguous at all the same time. So being able to identify which one describes your climate is critical to understanding what the most effective response might be. So as a nonprofit, how should we be responding to the COVID-19 pandemic? Are there specific policies and procedures that should be put in place? Well, I think this question is really germane to every nonprofit today. In these uncertain times, it is best to be as prepared as possible. Now, we know crisis management is difficult under normal circumstances. And with a crisis of this magnitude, it is even harder to predict what policies and procedures you should have in place. Let's take a look at two elements nonprofit organizations should consider in light of COVID-19 and our VUCA world: crisis planning and key policies that should be included or considered. So, crisis and disaster planning. The very nature of crisis and disasters is that they are unplanned, unexpected, and have serious impact on people, organizations, and communities. In the US, recent examples include the 9/11 terrorist attacks and Hurricane Katrina, Superstorm Sandy, Category 5 tornadoes, and other natural disasters. We see sometimes terrorism and other man-made and natural events and the upheaval they produce. These events, along with COVID-19, capture our attention and bring community members to action, both as volunteers and donors, and remind all of us that emergencies and devastation can come at any time, at any place. It is the successful agency who has designed a variety of resources, tools, plans, and actions to guide their response to crises and disasters. Now, generally, emergencies can affect 5 key areas. There's the physical or psychological injury to people. There's the inability to continue with important organizational operations. There may be damage to or destruction of facilities. Financial loss, apart from what we're talking about here. And then there is spillover effect from something that has affected some other person or organization that then impacts our own. Now, the importance for nonprofit organizations. As a nonprofit charitable organization, you occupy a key role in the response to a disaster. Nonprofits are often at the forefront of supporting those affected by disasters. Agencies such as disaster and relief organizations, hospitals, health and human services, food and housing organizations, and animal rescues are part of what I consider first responder teams in many emergencies. And many of these organizations continue to provide support long after the immediate event. So maintaining your nonprofit's health, strength, and capacity to serve others is vital to your community and constituents. Nonprofits also hold a unique place in the public trust and often come under immense media scrutiny. Crises such as financial or ethical impropriety on the part of a member of an organization can seriously damage its reputation or ability to continue providing services. Even irresponsible action by others in your field or in the larger nonprofit sector often has that negative spillover impact on your organization. So a proactive approach to addressing these issues will help you to come out on top after a crisis. And then the KSA. This is an acronym for knowledge, skills, and abilities. So we need to, as a nonprofit agency, safeguard the knowledge, skills, and abilities. That is the relationships, the passion, and the creativity of our human resources, our employees, who are an essential component for every organization. In the nonprofit sector, the contribution of the board and the staff are even more critical. Many nonprofits operate with only a small group of leaders, often playing multiple roles. So the unexpected loss of any member of an organizational leadership team presents a challenge for nonprofits, and the potential loss of several key leaders in a disaster situation can produce a major crisis for many nonprofits. So in dealing with crisis management is defined as an organization's pre-established activities and guidelines for preparing and responding to significant catastrophic events or incidents in a safe and effective manner. Crisis and disaster plans are a key tool that document the actions of the organization and detail how the agency will respond in the event of a significant crisis or disaster. Now, here are some benefits of a crisis and disaster plan. The focus on crisis and disaster planning ensures that your agency can prepare for emergencies to the best extent possible. Your agency is able to respond quickly and clearly to all constituents, that you will be able to continue to offer your essential programs, that you may be able to resume full operations as soon as possible and safeguard and protect vital organization resources. Now, there are risks of not addressing the issue through crisis and disaster planning. During and after a crisis, a nonprofit without a plan may not be able to provide essential services, generate earned and philanthropic revenue, retain or replace key organizational leaders. They may be subjected to negative media scrutiny, unable to safeguard your intellectual property, and therefore maintain the public confidence. So let's take a look at, for every nonprofit, the basic elements of what should be included in a crisis and disaster plan, especially in light of the COVID-19 pandemic. Now, I'm just going to speak briefly about these components. Depending on the type of services your organization provides and the environment in which you work, you may find that the components of your crisis and disaster plan may need to be more highly developed in some areas than in others. You may also find that your organization requires additional components to adequately prepare for disasters. So if you're interested in more information, please be sure to comment, and we may develop a webinar on just the development of a crisis and disaster plan. The Small Business Development Center may also be available for consulting services. It may also be advantageous to reach out to other similarly situated organizations working in your field or your region to explore and compare their disaster and crisis planning approach. At the basic element, every plan should define the purpose, the priorities, and the principles to start your plan. It starts with an explanation of why and how the crisis and disaster plan is relevant to your organization, its mission, and the people that you serve. This helps to communicate the organizational commitment to addressing crises and situations in a more focused and efficient way that safeguards your mission and assets that are held in the public trust. The next is designating the response team. The response team is the structure establishing the principles and implementing the policies for action in the event of an emergency. These plans describe roles and responsibilities of team members and provides up-to-date contact information for the individual. Assess your risk through different types of crisis and disasters. Events may occur that are either external or internal to the organization, and both will have serious impact on your capacity. So take into consideration your location, your community, your program focus in defining and prioritizing the risks that are most relevant to you. I'm sorry, went a little ahead there. The other element that you want to have is your business continuity plan. So business continuity planning is addressing some very specific areas. So you want to make sure that you have preparation, which are the actions taken prior to crisis or disaster. Ensure that you know what your response is going to be, the procedures and steps done immediately after an emergency or interruption to business, and recovery and restoration. The steps taken to restore the functionality so that some level of mission-driven service can be offered to clients while restoring the organization to its original status. This business continuity plan is an important tool, and its development will depend on many factors, including, but not limited to, the mission of the organization, the services provided, and the community served. Now, let's just talk about some additional consideration. We answered the question earlier of how a nonprofit should be responding to the COVID-19 pandemic by illustrating planning and policies. As you develop your plan, it is likely that you will begin to see connections between crisis and disaster planning and your policies, procedures, and operational plans that your agency has in place during non-disaster times. In some cases, a strong and well-planned systematic response will lessen the impact of a crisis or disaster. An established and well-functioning system of crisis and disaster response can make for a quicker response and certainly ease tensions and anxieties about the unexpected event. So the development of your crisis and disaster plan, in light of what you already may do, should include a review of related systems and plans and procedures, including things like your board, your staff, and your volunteer policies, program and service standards and compliance, insurance and risk management policies. I also serve as a member of the board for my homeowners association. In light of the COVID-19, many homeowners associations began shutting down their pools and gyms and recreational facilities, even their tennis and pickleball courts. We were uncertain about how the virus was spread and, to maintain social distancing. One of the things we discovered very quickly in our existing policies is that there are often virus exclusions, which means that somebody claiming that they became sick, especially due to COVID-19, as a result of their participation or close contact within the HOA would not normally be covered under directors and officers and liability policies. Therefore, as a board, we looked at additional insurance coverage, which only became known to us during this investigation of our crisis planning. And so we were able to purchase what's called a gap policy, providing assistance for legal fees with those concerns that are explicitly excluded or maybe not included at all under a D&O and liability policy. Technology and recovery and cybersecurity policies, we're going to talk a little bit more about those, but that is something that must come under review, especially in light of telework and working from home. Looking at our communications and social media policies the old way of reaching donors, maybe by mail, is not as effective now during COVID-19. Financial policies, including internal concerns and purchasing, are something to look at. Reserves. Many organizations with decreased charitable giving right now are having to go into their reserve funds and looking at policies on uncovering other factors, and also looking at succession planning and leadership development plans. This is going to be critical right now as staff maybe are furloughed or laid off, or board volunteers playing key roles are busy in other concerns in their personal lives and may not be able to continue. And then, of course, this all goes back to our robust resource development plan. So let's take a look at some of these more specifically. One of the things I think every nonprofit right now needs to be doing is looking at their leave policies. You might want to review your sick time and your personal leave policies if you've not already done so, because you will want to adjust these to reflect the requirements from the Families First Coronavirus Response Act. Let me talk a little bit about that in some detail, because I know these laws are quite confusing. So recently, I believe in April, Congress passed the Families First Corona Response Act, and the FFCRA requires certain employers to provide employees with paid sick leave or expanded family and medical leave for specified reasons related to COVID-19. Now, the Federal Department of Labor and the Wage and Hour Division is administering and enforcing this new law's paid leave requirements. And these provisions apply from the effective date back in April through December 31st of this year. So for your agency, generally, the Act provides that covered employers, and I'll talk about who's covered, but covered employers must provide to all employees 2 weeks, up to 80 hours of paid sick leave at the employee's regular rate of pay. Where the employee is unable to work because the employee is quarantined pursuant to federal, state, or local government order, or under the advice of a healthcare provider, and/or is experiencing COVID-19 symptoms and seeking a medical diagnosis. Or you may have to provide all employees up to 2 weeks, 80 hours of paid sick leave at 2/3 the employee's regular rate of pay. Now, this would be because the employee is unable to work because of a bona fide need to care for an individual subject to quarantine, again, pursuant to a federal, state, or local government order, or under the advice of a healthcare provider, or is caring for a child under 18 years of age whose school or childcare provider is closed or unavailable for reasons related to COVID-19, and/or the employee is experiencing a substantially similar condition as specified by Health and Human Services. A covered employer must provide to employees that it has employed for at least 30 days. Now, let's take that in for a minute. Under the current Family Medical Leave Act, FMLA, we have a certain number of hours over the past year. This expands the covered employee to anyone employed just for at least the last 30 days. And that is up to an additional 10 weeks of paid expanded family medical leave at 2/3 the employee's regular rate of pay, where an employee is unable to work due to a bona fide need for leave to care for a child whose school or childcare provider is closed or unavailable for reasons related to the virus. Now, as far as notice, just like we have with the, it's the law posters talking about wage and hour, minimum wage, overtime, discrimination and harassment coverage. As an employer, make sure that you are also updating your required posters with the Families First Coronavirus Relief Act provisions. Each employer must post in the conspicuous place on its premises a notice of the FFCRA requirements. Now, an employer must not discharge, discipline, or otherwise discriminate against any employee who takes paid sick leave under the FFCRA and or files a complaint or institutes a proceeding related to the FFCRA, similar to retaliation claims that we see under somebody filing a sexual harassment or discrimination charge. Now, as far as covered employers, the paid sick leave and expanded family medical leave provisions of the FFCRA apply to public employers and private employers with fewer than 500 employees. Now, this is a big departure from the FMLA, which talks about 50 employees and 25 employees under the ADA. It's all employers with fewer than 500 employees. But some small businesses with fewer than 50 employees may qualify for an exemption from the requirement to provide the leave due to school or childcare unavailability if that would jeopardize the viability of the business as an ongoing concern. So that is something that you would probably want to speak to your HR professional or your legal counsel to ensure your compliance. But that's only for the child care provision of that. So going back to the policies, besides staff leave in light of the Families First Coronavirus Response Act, let's take a look at some of the others nonprofits should be considering revising and revisiting. And that comes to mind with probably something that many of us did during quarantine and maybe still are doing, and that's telework. Looking at our remote workers policy, by now, we probably have something in place, but a remote workers policy will be helpful in keeping staff safe and ensuring that your business operations and services continue. Remember, this leads to many other issues in the HR and policy and procedure world, such as workers' comp. We cover workers' comp issues for people at work, but when they're actually working from home, safety and other issues like OSHA concerns become part of their home environment. So we've seen cases where somebody working from home gets up from their desk and trips over a lamp cord. Is that a workers' comp injury? That's their own lamp, their own desk? Well, yes, it is, because it's considered the work environment. Another issue, and actually something that I would be developing very soon, a webinar specifically on this topic, is on the Fair Labor Standards Act or wage and hour law, especially as it relates to remote work and people working from home, ensuring that we are meeting our obligations, especially for non-exempt employees and overtime requirements. Internal controls is another broad policy issue that nonprofits should be addressing at this time. Nonprofits and their boards should have already had internal control policies in place, but these are most likely changing in light of COVID-19. So things to consider include how to adapt your internal controls during remote work and social distancing. You may want to reach out to your auditor, as they're already familiar with and have documented your internal control policies. Maybe the firm will be able to make some recommendations for the short and long term, but definitely have some current and accurate listings of your anticipated grant payments and other accounts receivable. Have at least 2 people monitor this and make sure it's maintained and current at all times, and electronically accessible where possible. Reach out to these organizations that owe you money and make sure that you send them instructions on how to pay electronically via wire or ACH payments. If you don't already have those instructions, reach out to your bank for them. It's a fairly standard request. If organizations say that they've already sent you a payment via check to your office, perhaps consider stopping payment and making the offer to pay any stop payment fees, and then ask them to pay via wire or ACH. Do not under any circumstance forward mail from your agency headquarters or office to any staff person's home address. You want to think about as many short-term and creative solutions that will serve as bridges until we're on the other side of this. For example, I know one local nonprofit is utilizing technology where possible to monitor internal control processes. They're a fairly small nonprofit, and so the normal separation or segregation of duties with accounts payable and account receivable is something that is hard to maintain. So they're actually using things such as shared spreadsheets for cash receipts and using Zoom to open mail if one person goes to the office for that mail. Looking at programs and services, this should consider how well you continue to provide services to those you serve during COVID-19. This could include how you're going to address safety concerns and basic operational needs, and how you're going to ensure that you're giving accurate and timely information and instructions to those individuals and communities that need it. Consider how you're going to keep your employees and staff members safe. What does that look like? How will you communicate to staff and stakeholders and members of your organization the changes in services? And so this may lead to a more robust communications and social media policy. This would focus on your internal and external communications. And don't forget the internal, particularly with staff and stakeholders and your board. During this time, you may want to consider how you're providing information, including what's happening with your organization and whether or not you're sending out external resources to keep your community informed as this COVID situation continues to evolve. Don't underestimate cyber security and IT issues. We've all heard the horror stories of Department of Defense employees taking a laptop home and leaving it in their car, and it's stolen, and the laptop had personal social security and other financial information, home addresses of DoD employees. With staff now working remotely, consider how you're going to safeguard your organization's information. Additionally, this should cover what resources you will need to make remote work sustainable. There are many other policies you can consider, like a resource development policy, but these are conversations you need to be having with your board. You should look through the first resource I listed, compare it to the policies you already have in place, and see if it's possible that some or many of them have to be adapted to address COVID-19. Engage your board in a discussion about what your organization needs in the moment and what it will need in the future. So just wanted to share a little bit about the Fair Labor Standards Act. Again, I'm going to do a webinar on this, but essentially, even if people are working from home, make sure you're paying minimum wage, the overtime, and keeping people logging of the actual hours they're working when you can't track that in the office. I anticipate that there are going to be many complaints filed from employees who were working from home that are claiming that they're owed overtime. So we want to address those types of issues. Again, Florida minimum wage. Florida has its own minimum wage law. So if we're bringing in people, let's say your nonprofit has been awarded a grant to address some specific COVID-19 issues and you're bringing on new staff, new employees, and the grant oftentimes will talk about, federal minimum wage. That is not what we have to pay employees. We have to make sure we're paying them the Florida minimum wage, which as of January 1 is the $8.56 an hour. So one of the things I wanted to talk about is how COVID-19 is affecting charitable giving, to give our nonprofits the ability to, think about long-term and strategically how their disaster and recovery planning may have to address a decrease in revenue if that materializes. In the span of only a few weeks, the pandemic has literally upended daily routines and impacted communities across the world in unprecedented ways. There is not one corner of our society that has been left untouched by the effects of the pandemic, and this includes the nonprofit sector. So to understand how this pandemic could affect the nonprofit community, Fidelity Charitable conducted a survey of philanthropic individuals to see how they're thinking about philanthropy in response to the pandemic and how the situation could affect their giving and volunteering. And there's some good news. Most donors plan to maintain or even increase the amount they donate to charity this year. Now, support from donors is needed to sustain your nonprofit at any time, but it is particularly critical in times of crisis. So the good news is that for the nonprofit sector, a quarter of donors, about 25%, say they plan to increase their donations in response to COVID-19, while more than half plan to maintain their giving level. Now, the survey revealed that actually, and this may be useful information for your planning, that younger generations plan to step up their donations in greater numbers. 46% of millennials say they will give more in response to the pandemic, compared to only 14% of baby boomers and 25% of Gen X. So of those who say they will decrease their donations to charity, it's usually a concern over the recession and the economy in general that would be a trigger for that. So definitely keep those numbers in mind. In contrast, however, volunteer activity is likely to dramatically decrease due to the pandemic, with state and local governments urging residents to socially distance and maybe stay at home to prevent the spread of the virus. This is going to create challenges for many nonprofits who rely on volunteers to deliver critical services. So be prepared, because in this survey, nearly half, 47% of recent volunteers say that the amount of time they volunteer will decrease or stop entirely because of the pandemic. And older donors are more likely to say that their volunteering will decrease. 61% of the silent generation and 57% of baby boomers, while 19% of Gen Xers and 30% of millennials say they expect their volunteer time to be affected in some way. Most donors do not plan to shift their giving, so that's some good news for your agency. They don't plan to shift their giving to different organizations in light of the pandemic. They want to stay the course by continuing to support their favorite nonprofits. Many donors plan to continue supporting their usual charities, even during this pandemic. So that's good news for you. But a quarter of donors say they will give to different organizations as a result of the pandemic, shifting part or all of their donations to organizations responding to COVID-19. So when going back to that media plan, going back to your communications, external and internal, a critical part of that may be formulating your message to help donors understand how what you are doing is directly impacting the COVID-19 crisis in some way. Donors are most concerned about the way that COVID-19 could impact the ability of health and human services related nonprofits to do their work. But concern is high for all organizations in all charitable sectors. So under the circumstances created by the coronavirus, many donors' first thought is for the health and related nonprofits on the front lines, obviously, and then the safety net organizations that are serving our communities, especially our most vulnerable populations. 80% of donors reported that they are concerned about these nonprofits' abilities to operate. So time to capitalize on that sentiment and again, formulate your message accordingly. No organization is going to be isolated from the effects of the crisis. At least half of donors are also concerned about organizations working in other areas like arts and environment as well. So most donors don't feel that they have the information they need to effectively support efforts to combat COVID-19. Ironically, even though they plan to give more or maintain that level, donors are not sure, based on this survey, how they can effectively address the impact of COVID-19 with their contributions. Almost a third of respondents say they don't have the information they need to understand where they can direct their supporting efforts. Older generations feel particularly unsure of how to direct their donations. 35% of baby boomers said that they don't have enough information. So marketing and information is critical right now for your nonprofit. The impact of the virus is having a tremendous impact on the economy. That's undeniable. In Florida alone, as of yesterday, the Department of Economic Opportunity reported that it has paid 1,335,000 claimants, a total of $4.95 billion in reemployment assistance benefits. I've been a commissioner in the reemployment assistance world since 2001, and I find this to be unprecedented. Things may get worse before they get better. We may be faced with the difficulty and unenviable task of having to lay off some employees. Layoffs are hard for everyone, especially when the reason for layoffs are completely out of our control. Donations are going down, our revenue streams are not as projected. But no matter when or why you have to lay off a staff member, it's important to handle the process professionally. And this includes compassion, kindness, and understanding, along with the legal aspects. So I understand that layoffs may be the quickest way to cut costs, but they're also the most painful. So before starting that process, consider some alternatives. Can you cut hours? Can you eliminate overtime? Maybe hold off on raises? Maybe do a furlough, a temporary period of time before a reduction in force. You may not save as much money compared to laying off staff, but choosing one of these alternatives may be a better choice. Not only will you save money, but you'll keep staff employed, and in turn, your staff may be grateful that you were able to save their job, which definitely has been shown to foster loyalty to your agency and your mission. But make a plan. Check for protected classes. Make sure that we're not disproportionately affecting those that may be older, generally those 40 and above, anybody with disabilities, minority races. You may need some help. No two layoffs are the same. In some cases, you may be forced to lay off employees who possess institutional knowledge, and you don't want to lose that knowledge. However, there's nothing you can do to stop that. So, you need some help. Consider how that long-term employees leave and will impact your organization. if they take that knowledge with them. So as part of your layoff plan, consider asking people to pass that knowledge on. But don't be surprised if people aren't exactly open to your request. You'll likely have to offer some incentive for these people to stay on and train those who are not being laid off, but it could make a huge difference. And don't underestimate the impact on remaining staff. Think about that you're going to have people that are affected. That's part of that spillover that I talked about. Now, while people may be likely grateful they weren't laid off, they may still harbor many fears and concerns that could impact their work. So it's important to have a communication plan, especially when something as devastating as layoffs are coming. Crucial to make sure that your entire agency is on the same page, that you're sending the same message, and that you're providing an opportunity to listen to people and be empathetic and kind. While it may not always be avoidable with furloughs and wage cuts, reductions in force, it is equally important to handle the situation with compassion and grace. Telling somebody that they no longer have a job is hard on everyone, but employees can especially feel betrayed and insulted if a layoff is handled very poorly. So you don't have an idea of how somebody's going to react when you give them bad news. So just be prepared to listen. Unless the discussion veers into a threat, let the employee talk as much as they need. Even if they're venting and saying, don't fire me, don't fire me, remain calm, empathetic, and compassionate. It can go a long way to diffusing an already tense and difficult situation. Even if somebody goes on a long-winded rant because they're angry or scared or feeling hurt or betrayed, oftentimes they're just caught up in the moment and simply want to be heard. And one of the last things I wanted to talk about in light of COVID-19 and charities is your executive committee. I've seen where many nonprofits, maybe they're a large nonprofit with a large board, they're utilizing their executive committee more, especially with social distancing and not being able to have in-person board meetings. It's easier to get a small group together. We have to be careful about how we use an executive committee. As the name implies, it's a committee with special responsibilities. Oftentimes, it's composed of your officers and maybe key committee chairs, and they can act and have responsibilities above all committees. Usually, it can act on behalf of the full board in very limited circumstances. Its main purpose is to facilitate decision-making only between board meetings or in an urgent crisis circumstance. So be aware of the limits on authority. I've heard some horror stories where nonprofit executive committees are, amending bylaws, removing other board members, maybe hiring or discharging the chief executive officer, making changes to the budget, or making major structural changes like adding or eliminating programs or approving merges or even dissolving the nonprofit. The executive committee cannot do these things. That's not within the scope of its authority. So look at your bylaws, look at what your executive committee is empowered to do, and don't rule out the full board in consideration for these major things. I understand there are lots of benefits to having an executive committee act, especially with a large board, but your board regularly needs to take action and make frequent decisions. And we need to be able to have an executive committee to study and maybe make recommendations and then present those recommendations to the full board. So just keep in mind some of those special concerns, defined by the bylaws. It's not defined by the executive committee itself. The executive committee may never replace the full board. It reports to and is accountable to the full board. And even though the committee may be granted some special powers in the bylaws, the full board must always be confirming those decisions at its next meeting. and make sure that the executive committee doesn't marginalize the value and work of the full board. If the committee is perceived as an inner circle, a clique, if you will, outside members can clearly feel left out, and that's going to result in poor morale and even perhaps leaving the board, and those institutional volunteers would be going away. All right, well, I know I want to leave some time for some questions that you may have with regard to the show and what we're talking about. Just in case we may not get to your question, I wanted to show you that we have some contacts here, the St. Lucie EDC, the Economic Development Council, and the Virtual Business Recovery Center, the Florida SBDC locally, and our college's Corporate and Community Training Institute, and my own email at the college, should you have any questions on that. I did want to open it up. I see we have a question on internal controls. Our process for checks is to have 2 signers as an internal organizational process. Or I'm sorry, our process is to have checks signed by 2 signers, but that's an internal organizational process. It's not required by the bank. How can we do this in light of social distancing and work from home? That's a great question. Again, use technology. Maybe document the second signer's approval in an email or Google Doc, a shared drive, etc. So we can maybe have one person, the treasurer, the finance person, physically signing it, but we have the documentation that somebody else saw it and has approved the check, even though that signature may not appear. Michelle asks, any advice for employees who are still waiting for employment checks, or if they get a denial saying they were denied due to making too much, like for furloughed employees? Oh gosh, this is hard. I know the Department of Economic Opportunity, which is separate from my own agency. We handle appeals of cases. We don't handle the frontline processing of reemployment assistance cases. I would continue to go ahead and log on. There's a new website for claimants. Have them go ahead and claim that. I understand, have revised some of the questions to provide for the federal benefit. So even if they may not be able to get the state benefit, they should be able to go back and claim the federal benefit. As far as the PPA, the Paycheck Protection Act, that I don't have any information on. I know that many employers applied for those loans, and we're hoping to get some information on that. So let me see if I can dig up some further guidance on that, Michelle, and I'll try to get that answer to you. Steve asks, if we have to furlough an employee, how long may that last? So I guess the question is dealing with somebody that may be, rather than a reduction in force, temporary. And that's a difficult question to answer because it may involve a grant that's no longer funded. It may be a permanent reduction in force for an employee working only on that grant funded program. And if no other work is available to the agency, you may have to let people go. If it's due to a reduction in donations and you are looking to cut maybe the operating budget to reduce your salary burden, one thing to consider rather than a furlough or laying somebody off for several weeks or months, which would qualify them for reemployment assistance. And think about that. As a nonprofit, some agencies have elected to become a reimbursing employer. You have opted out of paying reemployment assistance taxes. So when you are faced with an employee filing a reemployment assistance claim, you get a bill from the Department of Revenue for the entire amount of benefits. So if you are a reimbursing employer in those situations, you know, cutting somebody by by laying them off or reducing them may not materialize into the savings that you envision. So one of the things I know some agencies are considering is staggering. Rather than furloughing somebody for, you know, an entire week or weeks or months, maybe considering 2 or 3 days off a month. So that way, an employee, while they may get a reduction in pay for the days that they're off, they're continuing work. And so this maintains employment, like I discussed before, but that may also allow the employee to be more engaged and reduce the risk of losing talent. Those are great questions. I know we may have some more. That's why I left up my contact. I know we're getting to about the mark of where we need to adjourn. I just wanted to thank everybody for their participation today. And I will look forward to seeing you virtually on another webinar. And please comment on any topics that you would like to have addressed in the future. Again, I'm Tom Epsky, and thank you so much for your time and your participation today.
Thank you so much for that great presentation, Tom. We greatly appreciate you joining us today. And thank you to all of our attendees. Please come back on Wednesday, the 17th. We're going to have an open discussion with a marketing expert that works with CCTI, Leanna Haig. She'll be answering all your questions about SEO, social media, and e-commerce in today's crazy world. With that being said, I'm going to go ahead and adjourn this webinar. Thank you all for coming.